When we think about all the key issues that we face in health, whether that's antibiotic resistance or the emergence of new pandemics or the role of multinational corporations in non-communicable diseases, we see that these are global forces which are shaping these issues, and there are global actors, global agencies, which are instrumental in shaping the nature of the response. So as faculty members, we're academics, but we also work with a whole range of national and international organizations that work in the health policy domain.
Every day as I step out of my class, I'm just confronted with so much beauty. And that is a privilege, because not only do I get to study in one of the best universities in the world, I get to live in one of the best cities in the world, and I'd even say the most beautiful city in the world.
Edinburgh as a city is awesome. It's got great views, the people are very welcoming, everyone is helpful, especially with students. Everyone wants to help a student in whatever way they can, and all of this have helped shape my year and made it a very fruitful and enlightening one I'm reluctant to see end.
So the MSc programs all have two components. So there's a taught component and then a dissertation component. And the dissertation component is actually really exciting. It's an opportunity for students to work one-on-one with faculty to develop an independent and original research project. And this research project will be something that the student selects in conjunction with a faculty member. And the faculty member will really serve as a mentor, helping them to conduct independent research and really become an expert in an area that will help them move forward in their careers.
We provide technical assistance and training to national governments, working with aid agencies like the World Bank. We also work with advocacy organizations and public health NGOs to assist them in their work. So we have familiarity and experience of how these organizations are tackling real health policy issues at the coalface. And we bring that learning and those experiences into the classroom, both on campus and also online.
A really great part of the program was that it offers a work-based placement option for doing your dissertation, where you can choose an organization to work with that's linked up with the university and go work with them and then write a report of your experiences there, and that becomes your dissertation. You can also do an independent workplace placement where you make a link with an existing organization or researchers and go out to work with them for a while and produce your own dissertation from that. And that's what I ended up doing. I met a group of researchers from Japan who had come to the University of Edinburgh, and I was really interested in what they were doing, so I talked to them more and we sort of developed a research plan together, and I went out to Japan to do my own primary research for my master's dissertation and then came back to Edinburgh to submit it.
A phenomenal experience and very enriching experience for students from the feedback that we've constantly received, as it opens them to that messiness and the complexities in the real world. It gives them an opportunity to apply their learnings and the theoretical perspectives that they have gained through the program into real-life settings.
So our students come from a diverse range of different disciplinary and geographical backgrounds. Most of our students are from overseas. In terms of discipline, we have everything from students with undergraduate degrees in biology through to social science, politics, and sociology, and everything in between. What we really want to see, I think, is students with a passion for global health and a commitment to addressing global health challenges through policy action. And there might be students that have a real passion for global health policy but can't necessarily take time off work or family or have the resources to come here and live in Edinburgh and study on campus for a year. And for those people, we want to make sure that they have access online to exactly the same learning resources, exactly the same world-class faculty, the same specialist expertise as those who can.